Hi, I'm Mike Biersmith. I'm an interventional cardiologist here at TriStar Summit Medical Center, and I've been practicing here since 2022. I was originally born in Santa Barbara, California, and grew up in Southern California, and went to undergrad in Notre Dame and various areas throughout the United States for training purposes. I went to med school at Eastern Virginia Medical School, and then over to the Buckeyes in Columbus, Ohio, where I did my general cardiology training. And then my terminal year of training was at Vanderbilt, where I was an interventional cardiologist. I moved down here with my wife. We have one kid, and we've been very happy here in Nashville. I first got involved in medicine because my mom is a nurse, and I think I was inspired by her and her interactions with patients and the gratification she got through her practice. I've always been involved and interested in kind of the science of things, and to me, medicine was the most logical melding of those two fields of science, but also taking care of others and the empathy that our nurses can kind of continuously provide for their patients. I think the greatest validating thing that I do in my job is the management of heart attacks. There's few things within internal medicine that are quite like that, where I meet someone who is truly on death's door in the emergency department, and through the work with the cath lab team, we're able to bring them from that and revive them and bring them to the place of safety and comfort. And when I'm driving home after those procedures, it's very validating that I've really helped someone, and that's what keeps me going. My patient care philosophy is one of longitudinal care. I think the issue that a proceduralist may have is they do a procedure and they never see the patient again. I don't prescribe to that. I think one of the things that makes Summit unique is we offer specialty care, but we're also in some capacity a general cardiologist. And so I am the person that is meeting you for the heart attack. I am the one who's doing the procedure, but I'm also the one that's seeing you in the ICU afterwards, and then in the clinic as you recover. When I meet a patient that we're about to do a procedure, I try to put myself in their place. And for most people, this is the first time they'll ever go through this, and it's a very kind of scary, vulnerable time. And so I try to walk them through the procedure in detail, give them the expectations, and tell them that they're not alone, because they're not. This is a team effort with myself and the rest of the cath lab when we go through these procedures. It's a scary time, but we're here for you. We're here to keep you comfortable and to get you through it, and we will. So I think to come from a place of empathy is very important, and something I try to do every day. I am a general cardiologist, but I'm also an interventional cardiologist, and in particular, the management of coronary artery disease. So these are people who require stenting. That's kind of my day and my night job. And so if you come to Summit and you're having a heart attack, you'll meet myself or one of my partners to manage that. One of the things I hope patients take away from meeting me here at Summit is to know that this is going to be a long-term relationship, that I see myself as a proceduralist, but also just a general cardiologist who's going to be there for you for your kind of long-term needs. And so this is going to be a kind of evolving relationship. And one of the most validating things I have now is clinic and seeing that people are doing well. And so I like to see that, but I'm here for you if you're not. And I look forward to taking care of people for a long time.